It's a risk that's easy to overlook, but that's what it is. Maybe that may increase soft fibromas. Thank you for watching. This is YouTube Medical University. Do you know about neck warts? I actually had one here myself. Ever since I was old enough to understand things, I had a wart here and wondered what it was. Since it didn't get bigger, I figured it probably wasn't something bad. And when I entered medical school, I learned that this is a neck wart, also known as acrocordon. I found out that it's called a soft fibroma. Since it was small and didn't bother me, I just left it alone. But as I started filming more for YouTube and such, I began to wonder if it really was a soft fibroma, so I got a bit worried and had a dermatologist take a look at it. And as expected, it turned out to be a soft fibroma. I was also able to get detailed information about the treatment methods from a specialist perspective. I realized that it's really important to know what kinds of treatments are available and how much they cost. Different dermatology clinics may offer different treatments. Some treatments are only available at this hospital. This video is for people with neck skin tags or appearance concerns. What kind of lifestyle habits should you adopt to prevent more skin tags from appearing on your neck? And what are the best ways to treat the skin tags you already have? Also, are the topical treatments that people talk about, which claim to cure them just by applying something? Do neck skin tag creams work? I want to address this responsibly from a doctor's perspective. At the end of the video, I will also introduce the treatment method that I personally recommend and would use myself, so please make sure to watch until the end. At YouTube Medical University, we share helpful videos from a doctor's view to help you get healthier starting tomorrow. If you'd like, please subscribe so you don't miss new videos. So first, let me briefly explain what neck warts, or soft fibromas, are. Medically speaking, soft fibromas are considered benign tumors. The word tumor might sound scary, but basically they don't cause any harm. They are especially common in women and are said to increase after your 30s, particularly around menopause. These neck warts often appear not only on the neck, but also on the face and underarms. I have similar warts under my arms too. Neck warts look like this. They're usually skin-colored or darker, painless, and very small, just a few millimeters. The thread-like, elongated ones often appear on the neck or underarms. Soft fibromas are called acrocordons or skin tags. When these grow, they're called soft fibromas, and when they get larger, swell and hang down, they're called pedunculated fibromas. Since they don't cause pain, most people who aren't bothered by them can just leave them alone without any real problems. However, sometimes they can be mistaken for something else and turn out to be a different disease, so if they're gradually getting bigger or causing pain, in those cases, there's a high possibility that it might not be a soft fibroma, so I strongly recommend having a dermatologist take a look. Some confusing conditions that can be caused by aging are: they could be warts, possibly viral warts. These are caused by a viral infection, so if left untreated, they can spread to the surrounding area or even to your family members. And for those who have reddish warts, these are called senile hemangiomas. Please note that their treatment is different from the treatment for soft fibromas, which I will introduce next. So what causes these soft fibromas? Why do they often appear on the neck? The exact cause of neck warts is unknown, but several factors are thought to contribute to their development. One of those factors is friction. As we age, the collagen fibers in our skin become thinner. Because of this, our skin becomes more sensitive to friction, and it's believed that soft fibromas may form as a reaction. So simply getting older is a risk factor, but friction on the neck itself is also a risk. That's why wearing things like turtlenecks that rub against the neck, people who regularly wear clothes that rub against the neck, or often wear metal necklaces that cause friction, may be at higher risk for developing soft fibromas. In addition, changes in hormone balance are also said to have an effect. People who are overweight are also more likely to develop these neck skin tags. One reason is that overweight people often have higher blood sugar and secrete more insulin to reduce it. While producing insulin, hormonal changes are said to make soft fibromas form more easily. As subcutaneous fat builds up, neck wrinkles form more easily, and the friction from these wrinkles may also promote soft fibroma development. Another often overlooked but easily preventable risk is ultraviolet rays. Some people may apply sunscreen to their face but not so much to their neck, or only apply it thinly. If that's the case, that could be a cause of an increase in soft fibromas. So, As a lifestyle habit to prevent these from increasing on your neck, avoid unnecessary friction on your neck. Avoid accessories and high-collared clothing. Protect yourself from ultraviolet rays and try to lose weight if you have excess subcutaneous fat. These habits may help prevent neck skin tags in the future. Some people aren't bothered by them, especially if there are only a few, but as they grow in number and size, some patients find them more troublesome than expected. So be attentive and cautious. So then, how can you actually get rid of these skin tags on your neck? It's often said that you can just apply a cream and the skin tags will fall off easily. There are actually videos like that on YouTube as well. However, when it comes to soft fibromas, there is no solid evidence that applying cream will cure them. People say things like Job's tears are good, or apricot kernel cream is effective, or that using ibokorori will get rid of them instantly, but none of these are effective. It's said that things like Job's tears might be effective against viral warts, so it's important to determine whether it's a viral wart or a soft fibroma. It's important to distinguish between the two. Some people have come to my clinic after trying to tear off their own warts, causing wounds and making them more noticeable. More importantly, injuring the area can lead to infection or uncontrollable bleeding. Please don't try to remove them yourself. So finally, how can you remove these neck warts? I'll introduce 3 main treatment methods. The first 2 are treatments that can be done under health insurance. The first one is probably the easiest to imagine. Surgical removal, in other words, cutting them off with a scalpel or scissors. Usually a local anesthetic is injected to numb the area. The neck wart itself is cut off, and since an incision is made in the skin, the wound is stitched up as part of the treatment process. This method is mainly used for relatively large warts, those over 1 centimeter. This procedure can be done for neck warts and similar cases, but as you might imagine, making an incision and stitching up each small neck wart isn't really practical. By the way, regarding this incision and stitching treatment, it depends on the hospital, but the cost is generally said to be around 5,000 to 10,000 yen. How are small neck warts treated with health insurance? This leads to the second treatment method. It's liquid nitrogen. Liquid nitrogen is minus 198 degrees Celsius. By applying this to the neck warts, it causes a cold burn. As a result, the neck wart cells die and the wart falls off. While it would be ideal to remove it in one session, liquid nitrogen treatment often requires 2 or 3 visits. The downside is that you may need multiple treatments. There are other disadvantages as well, such as pain, and there is even a possibility that a scar may remain. Even though it's called liquid nitrogen, it's basically a low temperature burn, just like a regular burn. This is called a post-inflammatory scar, and because the normal skin around it also becomes necrotic, a scar may remain, and the skin can become somewhat darker in color. Although you wanted to improve your neck and got treatment, if the condition worsens, it defeats the purpose. That's why some dermatologists avoid repeated liquid nitrogen treatments for neck warts. It's a lot of effort, and if the skin looks worse after treatment, it's a problem. So, some doctors opt out of this procedure. Some dermatologists are like that. A benefit is that health insurance covers it, and since liquid nitrogen treats various conditions, most dermatology clinics can offer this treatment. And the cost is also kept low, with the budget being about 1,000 yen per spot, so in terms of affordability, it might be a recommended option. And finally, the last treatment I'd like to introduce is the carbon monoxide 2 laser. This is not covered by health insurance, meaning it's an out-of-pocket procedure. However, it has become quite a common treatment for soft fibromas. The advantage of the carbon monoxide 2 laser is that, although it still uses carbon dioxide to burn off the growths with a laser, it can target the skin tags on the neck very precisely. That's its main benefit. You all know what a laser pointer looks like, right? Similarly, a much smaller laser can be aimed precisely at neck skin tags. Unlike with liquid nitrogen, there's less chance of post-inflammatory scarring, meaning it's less likely to leave a dark mark. After using the laser, there's usually a mark for a few days, but after a while, the skin tag falls off and the skin is usually left looking clean. One thing to be careful about is that since the area is burned with a laser, it becomes more sensitive to ultraviolet rays. After carbon monoxide 2 laser treatment, it's important to follow your dermatologist's instructions, protect the area from ultraviolet exposure, and avoid unnecessary outings. The cost is usually between 5,000 and 10,000 yen per lesion, depending on the clinic. It's not exactly cheap, but for those who really want to improve their appearance, I think this is the most recommended treatment, so please consider it. However, it's not just a matter of treating the skin tags on your neck and being done with it. These skin tags tend to increase as you get older and as your skin gets more irritation. Along with getting treatment, please also remember to be mindful of lifestyle habits that can help prevent more from appearing. And sometimes, what you think is a skin tag on your neck might actually be a different condition. To avoid such situations, if you notice the skin tag gradually getting bigger, or if you feel something is wrong, like pain or bleeding, there's a possibility it could be a different condition. I also have a video summarizing information about skin cancer in a previous video. I'd be happy if you could check it out from the description below after this. Now let's review. Most skin tags on the neck are called soft fibromas or acrocordons. In most cases, even if you leave them alone, they don't get bigger or cause any pain. Their main characteristic is that they are benign tumors, and the causes include aging and getting older. Physical irritation from things like clothing or accessories can also be a factor. Ultraviolet rays are also a risk factor. Conditions that may be mistaken for them include seborrheic keratosis, cherryangiomas, and viral warts. Many think creams cure them, but that's a misconception. I explained removal, liquid nitrogen, or carbon monoxide. 2 laser treatments are used. Share in the comments what methods you've tried. If you have tips, ways to stop worrying, or treatment methods, please share them. Also, please rate this video with a thumbs up or down. At YouTube Medical University, we post simple doctor-led videos to help you get healthier starting tomorrow. It would really encourage me if you could subscribe to the channel so you don't miss any new videos. Well then, see you in the next video. The way to stay young from your 70s that I, a general practitioner, learned from my patients became a bestseller in 4 categories on Amazon and ranked #1 in the gift rankings. In my everyday work as a doctor, I gathered the important ways of living and health tips that I learned from my patients into one book. It's a book that will make you think, I want to live a healthy life like this too. It's on sale now and getting great reviews, so please check it out.